It's just loading, sorry about that. Okay, we're good to go.
Hi, my name is Taylor Sargent. I'm a physician at Lurie Children's Hospital in Chicago, Illinois. And today I'm going to talk to you guys on behalf of the Children's Miracle Network hospitals about coronavirus, COVID-19, and children. So just a little bit of background about me. I have my MD and my PhD. My MD clinical specialty is in pediatric infectious diseases. And my graduate work for my PhD was actually in coronaviruses. I studied some human coronaviruses that cause the common cold and also the first SARS coronavirus. Nowadays, my research incorporates some other viruses, but also does some focus on some on the COVID-19 pandemic. Besides my academic credentials, I'm also a mom of 2 young children, something I'm very proud of, and it colors everything I do. Now, with those credentials, I also want to make sure you know I do have limitations. I am human. I don't know everything out there, but I will do my best to try to answer some of your questions today. But I do not have a master's in public health or epidemiology. I do have friends with those, and I've tried to learn as much as I can from them and will share what I know, but that is something, one degree I don't have. So I thought that today I would go over some of the basics of coronaviruses and what we know about SARS coronavirus type 2, the virus, the disease, how it affects children, and also some things just about the vaccines that have been in the news, and especially in the last couple of weeks. So to start, about coronaviruses. Now, I'm a visual person, and this is kind of hard for me to do virtual teaching if any of you guys have done it. So I'm just going to pretend that I'm sitting next to you, and on my piece of paper, I'm going to draw out some of the things I'm talking about. So a coronavirus is an enveloped virus, which means that it has kind of like the same part that's outside your cell, the cell membrane. It has a virus membrane, and that makes the outside part. Coming out of that membrane are these projections that we call spike proteins. And sometimes we refer to spike proteins just by the letter S. And that's one of the main components of a coronavirus. And actually, it's where it gets its name, because back in the day when they used to look at coronavirus particles under electron microscopy, so when you look really, really closely at them, what they could see were these spike proteins coming out around, and they reminded them of the corona of the sun, which you might be able to tell yourself. So that's where they got the name coronavirus. Fun fact, sorry, you know I'm a nerd. So inside the coronavirus particle is where you have your nucleic acid. And in the case of a coronavirus, that nucleic acid is RNA. And near that nucleic acid is another one of the viral proteins called nucleocapsid, kind of like the nucleus of a cell, where the nucleic acid, it's nucleocapsid, and that's also called N. And those are some of the proteins that I've heard come up in the media, and so I wanted to make sure you understood what those were. There are other viral proteins like an envelope protein and a membrane protein, but I'm not going to go into all of those. Just the big one is especially the spike. And now the spike is especially important because it's what helps a virus get into the cell. So if this is the virus, and then if this is a human cell down here, and this is definitely not a diagram that's going to be to scale. This spike protein is what helps the virus get into the cell. It's kind of like the key that unlocks the door to get into the cell. So the spike protein comes and it can bind that receptor. For the case of SARS coronavirus type 2, it's the ACE2 receptor. And then once it gets into the cell, and I'm going to skip the parts where the membranes fuse and everything, it can deliver that nucleic acid. So that viral nucleic acid can get into the cell. And then from that nucleic acid, it's actually that RNA, remember, and we refer to it as a plus strand RNA or a positive sense RNA, because from that, you can make proteins directly. You can also start to replicate and make more of the RNA itself. And basically what will happen, and this is extremely simplified and definitely not to scale, is more of these virions will be produced and you'll end up getting more coronaviruses. So that's the basic life cycle. And that's why you can see why that spike protein is so important. Now that's the actual virus itself. What about the disease? So the disease caused by SARS coronavirus type 2 is referred to as COVID-19. That's why there's kind of two different names. One is the virus and one is the disease. And so what we know about the disease is actually pretty similar to what went on with the first SARS virus, in that there's a couple different phases. So I'm going to draw a graph again, try to hang with me here. What I'm going to do here is this is going to be time on the bottom. So time going forward. And this beginning is when you first start to notice that you're having some symptoms. So when you first start noticing you're having symptoms is actually when you start to have a lot of the virus. So you have a lot of that coronavirus in your nose and in your body. And eventually your immune system responds and is able to bring that virus level down. And that's what it's supposed to do. And that's what goes on with most infections. So the virus goes up and then your immune system responds and can fight off the virus. And in most cases, if it's a mild infection, that's what will happen. You'll have clinical disease, and then the disease symptoms will go away. Your COVID-19 symptoms will go away as your virus goes away. Unfortunately, in severe infections, this immune system can actually make things worse. And what you have is, instead of these disease symptoms going down, they actually can go back and get even worse. And we think that some of that's due, a lot of that is due to the immune system. And because a lot of the research that's happened so far is focused on the immune system reacting to the virus, because that seems where a lot of the damage is being done, I'll briefly go over just parts of the immune system in big terms. I apologize to all of you immunologists out there. I'm staying very generic right now. So when you think about when you're infected with the coronavirus, there are these things called cytokines. And cytokines and chemokines, they're little proteins that are released and they go all throughout your body. And they can help tell cells to go to where there's an infection. And they also do other things like cause you to have a fever. Then some of the cells that are recruited by these cytokines and chemokines are T cells and B cells. So T cells are cells that can actually go and directly, some of them directly kill viral infected cells themselves, which is very helpful. And then there's other ones that actually can help B cells, and B cells are the cells that produce antibodies. So I know I've thrown a lot of immunology at you very quickly, but basically, when you think about the immune response and you start to hear people talking about how to be protected, there's lots of different ways that you can be protected. So antibodies, which is what we hear about the most often in the news, and it's one of the easier things to measure, especially compared to T cells. That's one way to be protected, but there are other ways, like your T cells. And both B and T cells, they can have memory. So when we stimulate them and then you get infected again, they can both sometimes remember that first infection. Okay, so moving on to what's going on with the children. And I'm really happy that the kids don't seem to be as clinically affected with the SARS coronavirus type 2 as the adults. And part of that might be because of that immune system, because maybe their immune system, maybe their T cells or their cytokines, we're still working on it, or their antibodies, it's able to control the virus and not lead to those deleterious pathologic effects where the adults seem to get sicker in that second phase. So luckily the kids seem to do okay overall. Of course, there are unfortunate exceptions to every rule. Then later on, some kids develop what's been a really jargon, big term, multi-system inflammatory syndrome for kids, or MISC, or a Kawasaki disease-like syndrome. It's basically kids seem to not have the active infection being their main problem. It's something to do with that immune system. Not exactly what's going on with adults and how they're getting worse with the immune system, but still it's immune system mediated. And while we don't completely understand what's going on, we do have many drugs that can target different parts of the immune system. And we are able to usually treat these kids. Of course, there are unfortunate exceptions, but I was just on clinical service last week and we had several of the children come in that either had acute coronavirus infection or some of the immunologic sequelae or the immunologic damage done. And we were able to tailor using different drugs, be antivirals or drugs that target the immune system, to actually help those kids get through. And most of them have gone home by now. So one thing about children and COVID, even though they're not clinically as infected, the question is, can they infect their parents and can they transmit and can they be drivers of infections? Because if anyone has been around little kids, you know, they're kind of little balls of snot, really. At least sometimes my children seem like that. They're not the best at washing their hands and, you know, using a tissue all the time. So when you're around kids, that's when you sometimes get infected with different viruses. So it would make sense that maybe kids could be spreading the coronavirus. And while I don't have a final answer for this, we need to do more research. It does seem like kids can get infected. They can have the virus in their nose. And there have been documented cases where the kid is able to transmit that virus to people around them. But there haven't been too many reports yet of very young kids having these huge spreading events, some like termed in the super spreader events. So the hope is that maybe that's something that is unique about the SARS coronavirus too, is that kids don't spread it quite as well, but we really don't know yet. And I think right now we need to take every precaution possible. That's the other thing that's really become clear to me, at least over the summer, is following these reports from the CDC and their MMWR. They talk about different outbreaks and about how people have responded. And what I've noticed is in summer camps and daycare centers and places that kids have come in and been infected and possibly spread it to others, the places where outbreaks have been avoided are those that are following the recommended guidance for mask wearing and distancing and washing your hands and reporting your symptoms. So the same that us adults are trying to do, wearing your mask, keeping distant, we need to keep that up with the kids, because the places that have had the outbreaks are the ones that unfortunately didn't follow that advice. Okay, now's the part I don't like to think about, which is, so if kids can transmit, what about the holidays? And what about going and visiting family members? And unfortunately, it's becoming increasingly clear with cases rising that that's just something that is not a real safe idea right now. We really need to stay within our own household. And while I'm not going to say that Thanksgiving is canceled, it's just going to be creative. I know in my household, we had to come up with some new traditions. I think they're not going to go away very easily because my kids liked them too much for Halloween, where we hunted for candy in the backyard. And so instead of, abandoning old traditions, we can just add on this year and maybe have Zoom holidays with family members that you can't always have Thanksgiving with because they're spread across the country. Or I've heard of people that don't have younger children but have older children using Zoom or other platforms to have them learn how to cook themselves and do some hands-on Thanksgiving preparation, whereas a grandparent or an aunt uncle maybe would have done that in years past. Pairing on some family traditions just with a different creative twist. It's going to be hard, I'm not going to lie, but hope is in the future. And we really need to try to get as many people through this upcoming season alive as possible. And although this holiday might not look how we want it to or how we always imagined it, we have to hope and get people through this year so that we can have them with us next year. And so that we can have those holidays back in the future with all of those people that we love. Now, the way we're going to get out of this, hopefully, besides wearing your mask, can't say that enough, is with vaccines. And I briefly wanted to touch on, and this is again a whirlwind of vaccines and coronaviruses. And SARS coronavirus type 2 specifically. So there are several different types of vaccines that are being developed and that are being trialed in humans. First of all, there's kind of the old standby historic type to make vaccines. One of those being where you just take a virus and you weaken it. And you can do that in many different ways, but basically it's called inactivated or attenuated. And then when the person is injected with the virus that's weakened or inactivated, the virus doesn't replicate or only replicates a small amount, just enough to trick that person's immune system to responding, but not enough that they would actually get infected or get those severe diseases after the infection. So if you say, sometimes when I get a shot or a vaccine, I get a fever or I get redness, that's good, because that actually means that your immune system is getting stimulated by that virus. It's not that you actually have the infection, it's that you've tricked your immune system. So some of those older platforms that are being investigated, the attenuated and the inactivated, you might hear of Sinovac, Sinopharm, those are some of them. There's also a traditional method using subunits, so just those different parts of the protein. And if you remember with the SARS coronavirus protein, one of the things they've often used is this S protein, since that's so important to get into cells. So they might just take that S or different parts of the S and maybe have some other immune stimulants in there. Those are subunit vaccines. And some examples of that would be like GlaxoSmithKline or Novavax vaccine platforms. Now, there are also some more modern vaccine platforms that are slightly trickier to go through. There's viral vaccine vectors that you can use where you take the RNA or you take different parts of the virus that wouldn't replicate fully, but you put them inside a different type of virus and then deliver it to cells. And that's like AstraZeneca or Johnson & Johnson have some of those viral vector vaccines. And then the most new and what's made the most news recently are the Moderna and the Pfizer vaccines. And those are actually where they take nucleic acid, so that RNA, and they don't use all of the RNA from the virus because you're not actually going to make virus that's replicating. They're actually just using the RNA that would have made that spike protein, and they put that in, and then your body will make the spike protein, which will then trigger your immune system, so those T and those B cells, to start responding as if you're infected, so that they'll develop that memory. And in the future, if you actually do get infected with the coronavirus, then you'll have antibodies and T cells that can respond to that spike protein and hopefully prevent infection and entry. And it's really, the results this week are really encouraging. I wait to see the full data that comes out, but I'm really hoping that the end is in sight, that we have hope at the horizon. There's a light at the end of the tunnel, and there's still some darkness to get through, but I have some hope. So in closing, before I take some of your questions, I just wanted to say, I'm tired. I imagine you might be tired of all of this, but I also know that someday our children and our grandchildren will look back to us and say, what went on there? And this will just seem so foreign to them. And I'm looking forward to that time where I can say we all stepped together and we wore our masks and we did what needed to be done to get through this dark period. And with the continued support that you all give to the Children's Miracle Network hospitals for our research and our care of children, and what you do in your own homes and your societies, communities around you, we can get through this together. And with that, I know I just threw a lot of science your way. I'm going to ask the representatives from Children's Miracle Network hospitals to throw some questions my way that you might have.
Thank you so much for your time today. So our first question we got in from Stephanie, and she's asking, what are the potential long-term effects if you do test positive for COVID-19?
Yeah, so there's been reports in the media about these so-called long haul symptoms from COVID-19 or from a SARS coronavirus type 2 infection. And it's kind of tricky. We don't exactly know what's going on. We don't know if it's just related to the immune system effects or if some of them might be from actually organ damage. We have a lot to learn, but it seems like it's on the rare side. So it's not something that if you test positive, you're going to have these things. It's more unlikely, but if you do have a severe infection, there's always chances that your lung could be damaged and it might take some time to recover. Only time will tell, and there's currently some more research being done in that area.
Thank you. Definitely helpful to know. Our next question comes from Julianne, who is asking, is there an ideal time to test someone during the onset of symptoms? And does this differ for children?
So the best time to test would be early on in the infection when you have that height of the virus, because most of the tests that are out there are looking at the virus itself, and they look at it then a couple different ways, usually looking at that nucleic acid for that RNA. Those are the most sensitive and specific tests. And so early on is when you have the most virus and it's more easily detected. There are other tests such as for the antibodies, and those are useful later to say you might have had infection in the past. But I would say within the first few days of symptoms is when you want to try to go get tested.
Thank you. Our next question comes from Ruth. What is a successful way to explain to kids the seriousness of COVID?
It's really hard. And of course, it's going to vary by developmental level and how much your individual kids are able to handle. So I've tried for my children who are really young to relate it to things that they understand and that they've had before, while reassuring them that they probably won't get very sick, but that nobody likes to get ill. So talking about if they've had a cold before, or when you threw up. My daughter hates throwing up. I hate throwing up. Who doesn't hate throwing up? She really doesn't want to get this virus because she doesn't want to throw up. And kids are having some GI, so their gastrointestinal. For some reason, it seems like kids more often are having that diarrhea and that vomiting. So when I talk to my kids about it, I'm like, some people are getting sick and they're throwing up or they're having a cold. You probably won't get very sick from it, but nobody wants to get sick at all. So we all need to wear our masks and try to keep each other healthy. And yeah, some people, especially older people, might get really sick. So we especially need to do things to, say, protect grandma.
Thank you for that advice. Our next question comes from Melissa. What do you know about children who have been immunocompromised and COVID? My daughter had a stem cell transplant 4 years ago.
That's a very good question, Melissa. And I hope your daughter's doing well. One of my areas of interest is what's happening with children that have gone through transplants specifically and coronavirus. And in general, it seems like they're doing okay. They might shed it depends on where they are and how their immune system has recovered in general, if they're still considered immunocompromised or if they are back to, pretty much having a normal immune system. But if they're immunocompromised, they might shed for longer, is what we've seen. They might test positive for a longer period of time than other kids, but they've been doing okay, at least at our institution. We haven't had anybody who's had a transplant getting extremely ill outside of, what other kids might have experienced. And then since some of the deleterious or the damage is thought to be from the immune system, a really interesting thought to ponder is, could having maybe a less hyperactive immune system maybe be a little protective? I don't know. But for right now, it seems like kids are doing okay if they're immunocompromised, but we're still waiting on all the data.
Our next question comes from Elizabeth. Are children's hospitals in Chicago or elsewhere being used for COVID patients as well? Are certain areas being turned into COVID wings?
Okay, so I want to make sure I try to answer the question. I'm not sure if you mean for adults or for just children, but we do have patients that are admitted with COVID-19 at our hospital. We have special isolation rooms that they can go into that have special airflow, and we try not to keep them near any of the children that would have immunocompromised conditions or be otherwise at risk for serious complications as best as we can. But they are here in our hospital, and we're trying to take care of them just like everyone else. I know other places, and we have offered to, if other hospitals need our help taking care of some of their pediatric patients so that they can make room for more adults, that is something that's been done. So, our hospital is a standalone children's hospital. We don't usually care for adults, but other hospitals have both pediatric floors and adult floors. And if they would need to turn one of their pediatric floors into an adult floor to make room, then, we've been helping out with that. And then I don't know if you meant, though, do we have our own COVID unit in hospitals? We haven't had the volume that's made that necessary. We're prepared for anything, and we hope anything, but there have been discussions about which rooms have the capabilities to have the best airflow and the ideal precautions and being shut off from the rest of the hospital, that if need be, that can happen, but we haven't had to do that yet.
Marilyn is asking, do you have a preference to either of the vaccines, Pfizer or Moderna?
Good question, Marilyn. I want to see the data. So far we've seen some press releases, and I really want to get my hands on the data, but they're very similar platforms. They both use the RNA technology and a stabilized spike protein. So I expect that they would be fairly similar. A big difference comes in their storage requirements, but that's not something that's going to affect me directly. When you're getting the vaccine, you just need to know that it gets to you or not. So right now, I have to say I don't have a preference, but I want to see the data.
What's the best way to describe about the importance of COVID when those of us who have major health issues have to work?
So it's really, it's a challenge in our society that we have to, some of us have to still go in and take care of others and perform our duties and go into work. And it's hard when you see people that aren't taking it as seriously as one would hope when you feel like you're sacrificing. I can empathize with you if that's the situation. And I don't have a great way to handle it besides, what my mom always says, you can only change what you do, and you can only, take responsibility for yourself. So being a good example and trying to wear your mask and trying to not let frustration with other people get in the way of what you have to do. And also talking to your supervisors and seeing, if any accommodations can be made. I hope that answers your question.
Thank you. Our next question from Stephanie asks, I would like to have a general health checkup, but I don't want to take time. I don't want to take away time and resources from patients with COVID-19 or risk myself. Is it safe or advisable to do so right now, or is telepath my only option?
So I don't want to give specific advice to people that I can't even see. I will say you can reach out to your individual doctor and see how they're handling it. I know that early in the pandemic, pediatricians were trying to prioritize certain groups, like young babies that really needed to get in. And then now they've expanded out to try to make sure everybody can have their well child checks and their preventative healthcare checks, because those are things that are important to do at least, once a year. I'll say I did have mine yesterday, actually. And the physician is someone that had an opening and they had everything very safe. My physician doesn't do COVID testing, and they are part of a larger center that refers any patients with the COVID symptoms somewhere else to a different screening clinic. So I wasn't taking a spot of somebody who was coming in or wasn't in the waiting room with people that also had concern for COVID. So I'd say reaching out to your individual physicians and thinking about your individual situations is most important, but it still can be done.
What are some common myths about COVID-19 that you can dispel?
Oh man, common myths that it doesn't exist, that we made it up. I can just tell you, trust me, it's real. I guess thinking back, some of them I've tried to dispel just in what I talked about already, where kids can't transmit, they can't get infected. We know those aren't true. They can get infected and they've been shown to transmit. The question of how much they can transmit is still out there. That someone designed this virus in a lab. I'll tell you that there are, you might not want to know this, but there's a lot of coronaviruses in nature. They actually, after the first SARS coronavirus outbreak 20 years ago, they went out and looked to see how many SARS-like viruses were around the world and where were they located. And they were able to find them in lots of places. Certainly China is one of those places because they're often in a lot of bat reservoirs, and bats can harbor coronaviruses and not get very sick. So they can just stay there and replicate and exist. But there's, bats in the United States too. If you look in the caves of the Carolinas and other places, there are different coronaviruses out there. So it didn't have to come from a lab. It's just from someone going into a cave and interacting with an animal and bat guano, or I don't exactly know how, and they're trying to figure that out right now, but it didn't come from a lab. Actually, interesting fact again about coronaviruses is there's almost a different coronavirus for every animal out there. Even little puffins, which is one of my favorite things to show on my slides to kids, is puffin coronaviruses. Anyway, I digress.
Thank you. We have another question from Elizabeth, who's asking, what is the research when it comes to the new COVID vaccine and children?
I swear I didn't plant you out there, Elizabeth. I wish there were vaccine trials going on in children right now because, like we said, we don't know their role in transmission, but they certainly can get infected. There are plans for some of the vaccines to be extended and trialed in children, but as is common, things are done in adults first before moving on to kids. So we don't know yet what it is because we don't know the data for children because it hasn't been done. But I know we're hoping to have some of those trials start soon.
Thank you. Chris would like to know, in a percentage amount, how effective are masks?
I don't have that off the top of my head. I'm sorry.
Another question we have is from Julianne, who's asking, with the vaccine on the horizon, is it known yet if we will have to get vaccinated yearly, like for the flu, or will it be a one-time immunization?
We don't know yet. And the first people that got vaccinated, it's barely been 6 months. We do know that in general, those antibodies that are stimulated either after regular infection or after vaccine, they can wane, they can go down. That's normal. What's important is those memory cells, and are they still hanging around, especially some of those T cells, and can they get revved up again really fast as soon as you get exposed? So those are questions we're looking out for. There's some promising new research that hasn't been published, but is what we call preprint. So it hasn't been reviewed yet, but it's been put online, that is very encouraging about long-lasting T cells and T cell immunity, which is hopefully something that's also going to be stimulated by those vaccines. And some of the data from the phase 1 and phase 2 trials of the vaccines did show that they were stimulating the T cells. So I'm very hopeful that they will have longer lasting, but time will tell. And I don't mind getting my flu shot every year if it means I don't have to have the flu.
Thank you. Our last question is, when is an appropriate time to bring in one of our children for COVID-19 testing?
So again, it's going to depend on each person's medical situation and the availability of testing in their region. Unfortunately, testing is still a scarce resource in some areas. And so what's being done in a lot of places is you have to go through a screening process, and your doctor will decide when and if testing is required. In some cases, if it's obvious the whole family is having the same infection and somebody tests positive, then they might decide not to test every single individual, but it's really going to be up to individual providers making those decisions.
Awesome. Thank you so much for your time today.
Well, thank you guys so much for having me, and I'm happy to answer any questions at a later time. Thanks.